carcinoid heart disease is a very rare phenomena, but it is a very, very important topic because once carcinoid affects the heart, the prognosis of the patient is very poor unless it is treated early and diagnosed early and treated early. Mostly, as we know, carcinoid involves the GI tract and it can metastasize to the liver. But there are rare examples where carcinoid can affect mainly the tricuspid valve and the pulmonic valve, and patient can present as congestive heart failure. Then you have to treat the patient according to the congestive heart failure guidelines. Once in a while, people end up needing the valve replacement surgery also. On the other hand, even though close to 78% of the cases are involving the tricuspid valve, but there are approximately 4% of the cases where the carcinoid can involve the myocardium, or it could be intramyocardial. And that can lead to heart failure or cardiac arrhythmias. Therefore, the diagnosis is very important. Especially the main screening test which is used is 5-HIAA. If that is elevated, that's an indication that it is involving the heart. And it becomes very important to diagnose it and treat it as early as possible. The mortality of untreated carcinoid heart disease is 68% in the first 3 years. That is why early treatment is very important. Echocardiogram remains the gold standard imaging technique for carcinoid heart disease because it involves the tricuspid valve in almost 78 to 80% of the cases. The other modalities such as CT scans or MRIs can also be used. And even though BNP can be raised in other conditions for congestive heart failure also, but BNP also has been recommended as a screening test for carcinoid. Once the carcinoid tumor is removed from the valve or from the intramyocardium, then the patient prognosis is really good and they do really well, and the 5-HIAA levels start coming down. There are no national or international guidelines on how to treat carcinoid heart disease, but there is a consensus panel which recommends that neuroendocrine tumor experts should involve the oncologists, gastroenterologists, cardiologists, and cardiac surgeons. And this team should work together when the patient presents with symptoms of palpitation, hypotension, flushing, which are typically seen in carcinoid people, and then you treat them accordingly. As I said, rare cases, the valves may not be involved, and it's the intramyocardial or intracardiac involvement of the carcinoid, and then surgical removal is very important and should be done as early as possible to avoid any life-threatening arrhythmias or cardiac transplantation.
GenWorks is here. Together, let's work towards a healthier India.